Hi, good day, good day, good day, and it is Dr. Faith Brebner here again, Deputy Chief Secretary, Secretary with responsibility for health, wellness, and social protection, and I am doing my third day wrap-up for the 11th International Conference on Public Health. We are in Bangkok, Thailand. Yes, yesterday I said Bangkok, China, but the jet lag was wild yesterday. So we are here in Thailand. This is the last day of the conference. So I wanted to do a quick wrap up of what we learned today. Again, let me go back. Let me look at the banner that is behind me. The theme is redefining public health, harnessing innovation, collaboration, and equity for resilient public health systems. And as I said on day one, my aim as Secretary for Health really is to ensure that we have a system in Tobago that works. And that includes looking at so many parts of it, because remember, a system is different pieces coming together to form a whole. Different pieces coming together to form a whole. That's what a system is. So we have to make sure all of the parts in Tobago are coming together to form a whole. So what are some of the areas? I have a couple things written down, but I don't want to make this too long. I have a couple things written down. Oh, so one of the things that we're talking about is this concept of screen time and screen time in children. We know what screen time is. The way we just give them the tablet because we want to keep them quiet in a little corner because we don't want them to be running up and down and bothering we. All yeah, as this, there's this YouTuber, social media gentleman who does come with the all yeah, all yeah, it ain't working, it's not necessarily the best thing. And we are seeing where they increased. I mean, this is intuitive. Our grandmothers used to tell us way back when, don't sit down too close to the TV and don't watch TV too long because it can hurt your eyes and it would affect you. And we are seeing some of the same things happening with the screen time for the young ones. So we are encouraging you, as much as we would love to hand them the screens, hand them the tablets, hand them the phone because it's just the easier thing to do. We need to be very, very conscious of that. Now, the other part of it is the fact that when they are sitting at their screens, um, it means that they are not being physically active. Yeah? So we're not just talking about the effect of the screens on their brains, but the effect of sitting, watching the screens on their general level of activity. Children, a big part of development in children is literal play. Play impacts how children's brains develop, how their muscles develop, how their cognition develops, how all of those things develop. And we need to ensure that we allow children to go out and run up and down, allow them to fall down, allow them to play outside in the dirt because that builds immunity, allow them to do all of these things because that is what is critical in terms of them really truly developing. So we need to be very, very conscious of that. So that's the first thing I wanted to chat about. We also had a thing where we were talking about how do we support families with autism. Now in Tobago, we already have the the Autism Association, I think it's called. But we really, really have to be more conscious, I think, and this is something that I have to think about as it relates to the social protection side of it, but also as it relates to the health side of it. How we work with parents who are treating with children who are on the spectrum, and the kind of support that we give those parents who are treating with children on the spectrum, because it takes a lot. It depends on how far along on the spectrum they are, the kind of care that's needed, but we need to be conscious of the fact that the parents and the guardians and the families need the tools to help them cope. They need the tools that provide the answers to them. You know what I mean? Because in many instances, they don't have the answers, they don't know where to go for the answers, and they do not they feel like they are alone. And when you feel like you are alone in any circumstance, the burden is significantly higher. feel that you're alone, the burden is significantly higher. So we need to figure out how to ensure that we provide the kind of support. Now that also means, for example, looking at our social welfare network and to determine in some instances whether the support that the state provides, even the financial support that the state provides, whether it works or whether it is inadequate. Um, because we may need additional schools, we may need um, the child to go to a special type of school based on what is, or based on the level of where they are on the spectrum, and the cost of those special schools and so forth is really it's really above what the average parent may be able to afford on their own. So we have to figure that out. I know, for example, currently we do have a committee that is working on developing a special school campus for Tobago. So we're putting together the pieces, and this is one of the areas that we definitely need to look at for that. Let's see, I don't want to be too long with this. Now, the last thing I want to talk about, which is something that we know, two more things I want to talk about quickly. Let me talk about this other one first. I think in Tobago, a part of our challenge is that we need to develop a culture of research. What does that mean? Being in this conference um, allowed me to see that we actually are doing a lot of stuff, and we're doing a lot of stuff well on the island. And we need to pat ourselves on the back because of how much we are doing and how well we are doing what we are doing. So that's on one hand. But I am only truly recognizing that and appreciative of that because I am here and I am listening to what the other countries are presenting as their current status quo. What do I mean by having an increased research component though? We need to document a little better where we are currently, so that is identifying our current baseline, and we also need to identify what we need to do better, and we need to actively use academia to push where we need to go, because the answers to some of these problems that we're having on the island is sitting right there on the island with us. It's just that no one has actually thought about it and researched it and pulled it together and included it as something that we can do, having been peer reviewed and having gone through the process of having other professionals kind of antagonize what you have recommended as the next step. Yeah. So I think that part of our challenges, we need to figure out how to get more academic connections with what we do on the policy and implementation side. Now, that means having our universities do a little bit more work, having them link closely with what we do at the health centers, the hospitals, as part of our social networks, as part of our social cities, social, what's the word, safety net. Yeah, that's, I think, is a term I'm looking for. And have those, that kind of research be done and have them presented at conferences like these, because I think part of what we are missing is the appreciation of us having so many of the ideas, having so many of the solutions already within us or already within our borders, and not necessarily having to look for them outside of Trinidad and Tobago. Yeah. Now, the last thing I want to talk about is going back to something I spoke about on day one, which has to do with AI. Yes, I know, a kind of like a new thing. I don't know if, like, I mean, I knew about it before, I was using it before, but I did not incorporate it in my life as much as I am doing now. Like last night, for example, I looked at a whole new review of GPT 5 that was presented a week or two ago by OpenAI. And I am looking today at, one of the keynote presentations or the plenary, I can't remember which it is, where this gentleman was talking about the fact that AI has advanced to the point now that for non-communicable diseases, we can actually have it do um, machine learning, which includes basically inputting patient data. So let me step back a little bit. Part of our problem with treating with non-communicable diseases is the fact that we identify the diseases too late. I think that's a problem with general diseases, all diseases, yeah? But if we are able to look at patterns, and if we are able to do the kinds of statistical analysis of large volumes of data to look at the patterns, we may be able to predict individuals who are heading towards getting a non-communicable disease before they get to the point where they are presenting themselves at a health facility. How do we do that? That includes machine learning and predictive analytics. Yeah? What does that mean? That includes us using the data that we already have for patients. So we have a lot of data sets. We have a lot of data already there for patients. That includes information about them from a year, 2, 3, 4, even 5 years before they became sick, quote unquote. They were probably at the hospital because they broke their foot, and we did the basic stuff. We did the blood pressure and sugar and all of that stuff because it's just part of our routine care. And then something happened, and then they later developed diabetes. They later developed high blood pressure, whatever. What we should be able to do is pull the data that we have from people from years before and use that to do kind of predictive analysis so that we can see, okay, this person who had this thing or whose blood pressure was this way, who had these other characteristics, whatever those other characteristics were, these groups of people are more likely to develop diabetes 2 years, 3 years, 10 years later. And we now have an ability, we now have machines, we now have AI that can actually help us do that kind of analysis of the data we already have and help us to predict what can happen in patients ahead of time. And I think that is a really cool concept. Now the other way AI helps is that it could actually help us, you know, as health professionals, sometimes we're not great at communicating with our patients. We're not great at communicating. And because we're not great at communicating, um, sometimes we give a diagnosis, sometimes we give information, and that information is not understood in a way that the patient can then use the information at the best of their ability. And AI could also help in breaking it down in a way that the patients are able to understand better than we have been doing in terms of communicating. So, okay, so I'm seeing the time on this, and I've already spoken for way longer than I wanted to. But yeah, so those were the areas that I thought needed to be highlighted. Again, we're looking at screen time. Send the picnic them outside for play. Now. Just send them outside for play. Then I go outside and play and run up and down into it a little bit. We are also looking at how we treat with autism and supporting parents with autism. We also looked at how we need to improve on our research and what we do for research in Tobago. And we also looked at how we can really truly incorporate AI in our health system in preventing on one hand, but even in helping patients understand their diseases so that they can help themselves. Anyway, guys, thank you for allowing me to represent the division, the THA at this conference, and I can't wait to work on implementation. Thanks.